Hi, we're at NIMHANS Bangalore for the 10th World Congress of Women's Mental Health, and today we're going to ask some very pertinent questions to delegates and doctors from across the globe. Let's see what they have to say.
So I think it's more about the financial struggles that we see here in our country and how I feel women are not financially independent, due to which they are also not empowered. And even when there are women who are independent, they are still, quite, suppressed under patriarchy, under a lot of social obligations.
The biggest challenge in women's health is the women to balance everything in their lives. So much women are now trying to work and be a mother and have successful careers, and still the society holds a lot of expectations, body image, self-esteem, and we need to be the best at all the fields. So I guess that's what plays a huge toll on women's mental health today.
A lot of issues get undiagnosed. This I'm talking as a clinical psychologist. So ADHD in women it has its very unique presentation, and it's a myth that ADHD is only boys are affected by ADHD. That is not true, because women's symptoms are very different, and they many a times get misdiagnosed or not diagnosed.
And I think that motherhood mental health sometimes is not so considered. Women are, like mother, are always obliged to be happy, to keep all the importance, responsibility about child care, and mental health disease is not so visible. So I think that our challenge is to go everywhere to make a sensibilization of mental health issues, to make it more recognizable and accessible.
The first thing is the stigma, of course, because even if the family decides that there is an issue, does not decide upon the treatment. So that is one part. Second is accessibility. We know the need is there for rehab. The fact that there is no only women rehab around, they are very rare. I know of 2-3 who have just come up. So safety concern is another issue that comes up with the case. So I think if we can work on that area, it's wonderful. Another one more concerning area is the perinatal and postnatal, because the postpartum blues are often, seen as something that happens regularly, so that is not addressed. I think these are some things if we pick up and take care of it.
Need to focus more on common mental illnesses and make the women center of their mental health care, not anyone else take decisions for them. And there needs to be a lot of outreach programs, tele mental health services, home-based mental health services, I think, which will be helpful for women in the long term. And there should also have some kind of policy recommendation focusing on women's mental health.
If we had better ways of, from childhood, being able to manage these stresses, build communities which are more, less violent, be a way of communicating with another person, treating them with respect is, I think, it really takes very simple steps of being kind and having a gentler society.
In terms of inclusiveness, whenever the mental health services are encountering a women with mental health problems, I think not just addressing the individual, but at the same time involving the whole community around her to whatever extent possible. The psychoeducation to the family members about the specific issues that particular woman is going through in the context of her biological age, biological phase, and make them aware how to treat her. I think a lot more empathy and understanding of women's mental health should start at home. So that's why I think it's important to look at it in a very systemic and systematic way, rather than looking at it like an individual having a mental illness. So that's number one. And I think the sensitizing the youth and children specifically about women's mental health and the manifestations, how it's different and how it should be treated, should start from very, very young age, both for boys and girls, so that when they become old, they start to recognize and support the women